Understanding pregnancy bleeding. Spotting versus heavy bleeding with clots.
Hello and welcome. Today we'll be talking about a crucial topic concerning pregnancy, distinguishing between normal spotting and heavy bleeding with blood clots. This information is crucial for understanding when it might be necessary to seek medical attention. Remember, early detection and proper intervention can make a significant difference in pregnancy outcomes.
What is normal spotting?
Spotting during pregnancy is light bleeding that's typically pink or brown in color. This might occur at any time throughout the pregnancy, but it's most common in the first trimester. Spotting is lighter than a regular period and doesn't last long, usually a few hours to a few days. It is usually not accompanied by other symptoms such as cramping or pain. Some women may experience spotting after sex or a pelvic exam due to increased blood supply to the cervix.
What is heavy bleeding with clots?
On the other hand, heavy bleeding is similar to a menstrual period or even heavier. It may be red in color and could include blood clots. Heavy bleeding may also be accompanied by other symptoms such as abdominal pain, cramping, dizziness, or fainting. This kind of bleeding, especially when it's accompanied by pain or occurs in the second or third trimester, can be a sign of a serious issue, like a miscarriage or a placental problem, and should be evaluated by a healthcare professional immediately.
How to differentiate between spotting and heavy bleeding?
There are a few key ways to distinguish between spotting and heavy bleeding. 1. Quantity. Spotting is much lighter than a regular period, while heavy bleeding soaks through pads or tampons, similar to or heavier than a menstrual period. 2. Color. Spotting is often brown or light pink, while heavy bleeding tends to be bright red. 3. Duration. Spotting typically lasts a few hours to a few days, while heavy bleeding often lasts longer. 4. Accompanying symptoms. Spotting generally occurs without additional symptoms, while heavy bleeding may be accompanied by symptoms like cramping, abdominal pain, dizziness, or fainting. Remember, any bleeding during pregnancy should be reported to your healthcare provider, even if it seems like normal spotting. Thank you for joining us in this important discussion on pregnancy-related bleeding. We hope this information helps you understand the differences between normal spotting and heavy bleeding with blood clots during pregnancy. Remember, always consult with your healthcare provider if you experience any form of bleeding during pregnancy. It's always better to be safe than sorry. Stay healthy and informed.